Medical practice is now in an era where more and more patients are chronically symptomatic, yet standard biomarker testing looks normal. These are patients with cognitive decline, mood changes, chronic fatigue, post infectious syndromes, autoimmune illness, mild traumatic brain injury, or complex inflammatory conditions. Their symptoms are real, their impairment is real, but conventional neuroimaging was never designed to detect subtle, diffuse, or early stage brain changes. That is the clinical gap NeuroQuant was designed to address. NeuroQuant is an FDA-cleared clinical software program approved in 2006 that transforms a standard non-contrast brain MRI into quantitative volumetric data. Instead of relying solely on just visual inspection, NeuroQuant segments the brain into dozens of cortical and subcortical structures. It measures their volumes and compares those values against large normative databases adjusted for age and sex. In practical terms, NeuroQuant converts anatomy into numbers, numbers that are clinically meaningful that we can compare and monitor over time. Importantly, this does not require a new scanner or contrast agents or changes to clinical workflow. It runs on a conventional brain MRI using technology that you already use and trust every day. Clinically speaking, NeuroQuant becomes invaluable in two major contexts. The first is in well-recognized neurological conditions such as Alzheimer's disease, Parkinson's disease, epilepsy, and traumatic brain injury. These are conditions where structural change is expected, but where early detection and objective monitoring are critical. The second context is one that has become increasingly familiar to clinicians. The MRI report comes back as normal. The radiologist finds nothing overtly abnormal, but the patient in front of you is still struggling cognitively, emotionally, or physically. You know something's wrong. The patient knows something is wrong, yet the imaging offers no clear explanation, leaving both you and the patient without the objective validation needed to move forward with confidence. Many chronic illnesses affect the brain in ways that are diffuse, metabolic, inflammatory, or neuroimmune rather than focal or lesion based. In these cases, symptoms often precede visible damage by years. NeuroQuant allows clinicians to detect subtle, early, or distributed volumetric changes that may not be flagged in a traditional radiologist report. The scientific literature now supports volumetric brain abnormalities across a wide range of chronic conditions. These include mild traumatic brain injury, metabolic disorders such as type 2 diabetes, autoimmune diseases like multiple sclerosis, lupus, inflammatory bowel disease, and celiac disease, neurodevelopmental conditions such as ADHD and autism, and psychiatric disorders, including depression, anxiety, bipolar disorder, personality disorders, eating disorders, and psychosis. Volumetric changes have also been documented in chronic infections like Lyme disease and viral infections, in chronic fatigue syndrome, long COVID, and in environmentally acquired illnesses such as chronic inflammatory response syndrome, also known as SIRS or biotoxin illness. Across these conditions, brain volume abnormalities often correlate with symptom burden, disease severity, and in many cases, treatment response, even when conventional imaging appears unremarkable. It is important to note that NeuroQuant does not establish diagnoses on its own. It is a decision support tool designed to strengthen clinical reasoning when interpreted within the broader context of patient history, symptoms, laboratory findings, and functional assessments. It supports, it does not replace clinical judgment. For patients who have struggled for years with persistent symptoms and inconclusive testing, NeuroQuant often provides objective validation that something measurable is occurring at the level of the brain. This is particularly relevant in clinical settings where access to advanced biomarkers is limited or where conventional diagnostic tests are known to produce false negatives, such as chronic infections or subtle traumatic brain injury. In these contexts, NeuroQuant offers a stable, objective anchor to guide decisions in the clinical settings. We are entering a fundamentally different era of neurological care. Neurodegeneration is no longer something we have to assume is inevitable or irreversible. Today, we have interventions capable of reducing neuroinflammation, improving cerebral metabolism, normalizing volumetric abnormalities, and promoting neuroplasticity. NeuroQuant allows clinicians to monitor these changes longitudinally. It transforms treatment from something that is purely subjective into something measurable, trackable, and accountable. In this sense, NeuroQuant is not only an assessment tool, it is a tool for monitoring progress, optimizing care, and practicing precision medicine. NeuroQuant includes several clinically relevant reports, each serving different purposes. For example, the General Morphometry Report provides a global quantitative overview of cortical and subcortical volumes, including hemispheric asymmetry, expressed both as physical volumes and as a percentage of intracranial volume. This report is particularly useful for global reference, longitudinal monitoring, clinical research, and to assess for patterns consistent with chronic inflammatory response syndrome, or CIRS, or also known as biotoxin illness or mold-related illness. The Triage Brain Atrophy or TBA report offers percentile-based normative analysis across about 47 brain structures, allowing clinicians to identify patterns associated with neurodegeneration, traumatic injury, mental health conditions, and neurodevelopmental disorders. The dementia report includes the hippocampal occupancy score, a standardized metric with increased sensitivity to medial temporal atrophy and early Alzheimer's risk, along with longitudinal visualizations for tracking progression. The seizure report is often used for the evaluation of suspected focal or medial temporal lobe epilepsy. It focuses on quantifying hippocampal asymmetry, typically as a complementary structural assessment alongside tools such as EEG. In some cases, similar patterns of hippocampal asymmetry can also be observed in other clinical contexts, including traumatic brain injury, early Alzheimer's disease, post traumatic stress disorder, and infections affecting limbic structures. There are several simple ways clinicians can work with NeuroQuant through US SIRS Lab. One option is to order a standard brain MRI at an imaging center or hospital that already holds a NeuroQuant license. In this case, the NeuroQuant analysis can be integrated directly into the imaging study. If you are a practitioner who is looking to use the NeuroQuant in the context of SIRS, it is very important to verify which NeuroQuant software version the facility is using. This is because the reports need to be generated using version 3. If the imaging center is using a newer software version, such as version 4 or 5, you can simply send us the raw DICOM files and we will convert and populate the reports in version 3 for you. A second option is to have SIRSLab provide NeuroQuant reports. In this case, we provide you with the appropriate MRI acquisition settings ahead of time. You can then ask the imaging facility to apply these settings during the scan. Once the MRI is completed, you can send us the raw imaging DICOM files and we will generate the NeuroQuant reports on your behalf. Once a NeuroQuant report has been generated, whether through an imaging center that already uses NeuroQuant or through a scan coordinated with the proper acquisition settings, this is where SIRSLab can come in to help you and your patients make sense of the data. A core part of what I offer is one-on-one interpretation sessions directly with patients. These are deep dive conversations designed to help patients understand what their NeuroQuant results actually mean in the context of their chronic illness. We walk through how factors like inflammation, infection, metabolic stress, or environmental exposures could be contributing to changes in brain structure. Just as importantly, These sessions help patients move from fear or confusion toward clarity. They begin to see how their illness may be affecting their brain and what they can do to protect and support their neurological health moving forward. We also outline potential practical steps that patients can then bring back to you, the treating practitioner, so decisions remain collaborative and grounded in your clinical care. In parallel, I also work directly with clinicians who want to become more confident using NeuroQuant in practice. For practitioners who see the value of quantitative brain imaging but want guidance, I offer personalized training and consultations focused on interpretation, pattern recognition, and appropriate clinical use. This allows you to gradually integrate NeuroQuant into your standard care model, knowing you have expert support as you build experience and confidence with the technology. Our understanding of chronic illness is changing, and the brain is becoming a bigger part of that conversation. NeuroQuant is one of those tools helping move us forward, especially in cases where patients don't look abnormal on paper but clearly aren't doing well. NeuroQuant doesn't replace clinical intuition, it sharpens it. It helps patients start thinking about their brain earlier, not just when something is clearly wrong, and it helps you make more informed decisions over time. It creates a shared language between you and your patient, a clear framework for tracking healing, and a bridge between lived symptoms and measurable brain structure. NeuroQuant represents the direction modern brain-based medicine is moving. In today's clinical landscape, quantification is no longer optional, it is foundational.